Welcome to Jordan's Journal. I'm glad to be here today. Today as my special guest, I have Representative Ryan Yamane. Good afternoon, Ryan.
Thank you.
Hello.
Glad to be here.
I'm on the Health Committee. You're the committee chair. But before we get into that discussion, could you kind of say what area you represent and a little bit about yourself?
Okay. Well, my name is Ryan. I am the current chairman of the Health Committee, and I've also been fortunate to be the vice chair of Consumer Protection Committee. So we have two hats. My area that I represent currently is Mililani and Waipio Gentry. I've lived in Waipio Gentry for probably about 17, 18 years, homeowner.
Wow.
My background is I have two young boys, very proud of that. I'm born and raised on Oahu, went to public elementary school, then I went to St. Louis High School.
Wow.
I went to University of Hawaii. I got a master's in social work, and then I went back and got a master's in business. So I have a wide variety of social work backgrounds.
So how long have you been in office?
I've been in office for 7 years, so I'm on my 4th term, and I've been very fortunate so far.
Wow. And you've been the chair of the Health Committee for how long?
This is my 2nd term, so 3 years, and prior to that I was the chair of Tourism and Culture.
Wow, wow. Now, I sit on the Health
Yes, you
Committee. This is my freshman year,
Yes.
so I'm still learning everything, and so I'm one of your committee members.
Yes.
So I'm still kind of learning the makeup of the committee and what's the responsibility of the chair versus a committee member. So what does the chair of a committee have to do?
Okay, well, first of all, for the listeners to know that and the viewers to know that, you've been an active, positive participant in the Health Committee. So as chair, I appreciate not only your questions and your participation, but, your involvement with the process. And so, excuse me, as a chair, I'm very appreciative of having members that are very committed. So I'm glad, that you're enjoying it, I'm hoping. As a chair, a lot of the issues on health policy will come through the chair. And so as one of the roles of chairman is you determine what is the package, what is the policies, how the policies will play itself out and work its way through, as well as determining priorities for the legislature.
Ah, okay. So do individuals like me as a representative or community members come straight to the chair and say, hey, I have this idea or I have this issue? Is that how it works? Or?
It actually can work a number of ways. So one is, yes, you can come straight to the chair and explain to the chair, new ideas, and a number of people do that. We've had people come to us to talk to us about environmental radiation, to depleted uranium, to access to pharmaceutical medications, co-payments, to complaints regarding their health insurance carrier and various professionals, a wide range. Or they can actually go directly to their area representative, which is highly recommended. So for example, those on the Leeward Coast, if they have questions about healthcare or what's going on, to call you up and then explain it to you. And like you've done on a number of issues affecting your residents, you'll come to the chair or develop legislation and you can introduce it and we'll work it through.
Oh, okay. And then that process is we have hearings on these particular issues once they're presented on an agenda?
Well, it depends on, that's one of the difficulties with the number of House of Representative members and the number of bills, right?
Yeah,
so, for example, 2 years ago, we had about 360 bills introduced by just House members. And so there's no way, enough time for me in the calendar to be able to hear that many bills. So usually as chair, what I do is I'll look at what bills overlap, which bills are need to be done constitutionally or through the Hawaii revised statutes, and then we prioritize that. So in actuality, the amount of bills actually heard out of 360 may be 80, 90.
Oh, yeah.
Yeah, and so, and some bills need to mature enough, meaning they need to get more input, and we ask members to, start getting that discussion, and other bills are bypass our committee because of the level of importance and can move on to the next committee. So there's a number of issues, a number of bills, but I will tell you what adds to the value of those bills is to have, let's say, like with yourself, if they come to you and it's a priority for you, and then you come to me as chair and say, you know, Ryan, these are some issues affecting my community, how can we work it? Then you and I work together to determine, is it the appropriate way to do it as a bill, a policy, or maybe we should work with the administration on this instead of a bill, or maybe there might be networking that we can do instead to get this issue resolved. And so there's a number of reasons why a bill might be heard or not be heard.
Yeah. So, like when you're saying overlapping, they might have similar issues in like 2 or 3 bills, and to say how can we combine it into possibly one and look at those particular issues on one version instead of like 4 different times. Now, when you don't have enough time, you know, my understanding is sometimes you might have 3 or 4 hearings on one specific bill. So that's what you're talking about in time. How do we meet all those constraints with the time just in the House side? And then once things get through this process, then they move over to the other side and allow the time to be heard over there. So that's what you're really talking about, time. It's not like we're saying we ain't got time for everybody. It's we're limited. You have 1 or 2 hours of a committee hearing, and you might have what, almost sometimes 10 or 12 items on.
Well, we actually, you know, we've had some in the 20s and 30. But yeah, good you're clarifying on that, because for people to know is on health days, we only have 2 days of hearings, and it's not a week assigned to us to use the room, and it's not all day. You know, as you know, because of session starts at noon, you know, we can have session anywhere from 8:30 to noon. After session, after our noon session downstairs in the chamber, it goes to another committee in the afternoon. So to actually have the hearings, we're very limited with not only time and space, but access. And so that's why it's very key on, as a chair, to try to coordinate what levels of bills can be worked on together, and how that goes. And again, time can be very difficult for especially the House members, because we have so many bills introduced.
So it's really important that if it's an issue that you really want to work on, maybe during off session they should have discussions with that, and as you say, mature a bill, meaning do a lot of the footwork, the legwork, your studying of the issues to kind of get it really refined. That's what you're kind of saying right there, right? Oh, okay.
As well as to be aware that just because you introduce a bill one year, that it's going to pass that year. There's a number of times there's other issues that pop up that you may or may not have been aware of, and so the hearing process, which, you know, that's why our session is the way it is gets multiple hearings both in the House and the Senate, and then that process is where different ideas or contradictions or other solutions might pop up, and those might need to be worked on. So again, you know, when I first got elected, people told me it takes 7 years for, you know, a substantial bill to go through. And so, you know, again, we want people to be aware of there's a number of facets and how it impacts and how government is affected by any type of legislation.
I mean, I think we're seeing that with some of these bills, and when you can get a bill and you start really working on it and refining on it, it could take multiple years, and then the public now has the process during all the House committee hearings, all the Senate committee hearings, to come in and talk about it, pros and cons. I mean, so it's all an open process for everybody to come in and say their mind on these particular issues, right? And in the end, we can still have something that'll just hunch it at the end and say, didn't make it, right?
There's a number of ways bills don't make it through. You're absolutely. As well as, you know, coming from the Leeward Coast, I know travel and it can be very difficult, plus finding parking. And so, you know, the process now is you can submit testimony via email. You send it to the committee vice chairs, you know, for testimony. You can submit the testimony early to the respective members or the introducer or the chair. And so there's a number of ways that the community, the public, could give input on any measure that affects our committee. And our committee influence is quite large.
So the Health Committee is, I mean, that's one of the larger committees, isn't it?
Yeah, our range of issues are quite large, yes.
And then when you're talking about the Health Committee, I mean, it affects almost everybody, right?
It can, yes.
I mean, you're talking health issues, health concerns, I mean, you know, public corporations that deal with health. I mean, yeah. I mean,
Licensing.
It can be wide range. That's what I say.
Very wide range. Yes.
Okay. Now, dealing with all those, so you're as the chair, you handle the meeting itself. So now you're saying that the hearing, people can submit testimonies to like the vice chair. So you have to have that working arrangement with your vice chair to get all those, testimonies for those particular bills on the agenda, and then forwarding it on to you or having that discussion. So the public really doesn't have to come in here and testify. They can actually submit online and express their opinion that way, right? Wow, that's excellent. Oh.
And I'm very happy with my vice chair. Mine is Dee Murakawa from Kauai, and just like yourself, she's committed, works hard. But I think all of my members are very intelligent members of my committee. Many of them have different perceptions and understandings of a various issue. However, they are very committed to doing what is right. So, as a health committee chair, I'm very glad that they're participating and active in the committee.
So, being the health committee chair, what kind of issues have you seen come through, maybe in the last couple of years, that has been really on one side of the issues, or has been a multitude of issues?
Well, again, our range for health is quite, wide range, right? So one area of health that's not in our committee is environmental health. For certain parts, but things relating to, let's say, vector control and food poisoning, pandemics, public health fall under my committee.
Oh, wow.
But we also do licensing issues. So nursing, physicians, professional license regarding healthcare professionals fall under our purview. Also, the state hospitals and areas of the federally approved health centers fall under our purview as well. And then, we're talking about nursing in the schools, fall under our purview regarding me overseeing, in some sense, the policy aspect of Department of Health. And social health issues also fall under, our committee, and you've heard many of them, from professions who disagree with each other to access to care issues. So, for example, pharmaceutical access or co-payments fall under our committee. Dealing with health insurance, from private to public to, who qualifies, fall under, again, our committee. And then myself and Human Services, we have a slight overlap on issues of Medicaid, Medicare. Medicaid falls under John Mizuno's Committee of Human Services. However, the hospitals that provide those services and access to those services fall under the area of our committee. So we work in tandem on quite a few issues.
Yeah, so then you also have to have these relationships with the Human Services Committee, because you'll have overlapping issues that would have to be heard in both committees.
And you being vice chair, it's very key for, you and I have worked on a number of issues on collaboration on, which purview, how is this going to affect what we deal with what you do in Human Services. And so it's very important to have, a young, new representative like yourselves so willing to engage and work together on issues, because a lot of times you might get informed of one issue, one side, and it takes more digging in to see where the balance comes in.
So then sometimes you might have to have, I guess, like a joint hearing. So you would, on the issues that are similar on these particular bills, that would have to go through both committees instead of delaying the process. You'll have a joint committee and hear the bill simultaneously with like a Human Services and Health.
Right, and we've done that a number of times with Chair Mizuno, where we'll have joint hearings where he hears the bill that overlaps with health, and then we hear their bills that overlap in Human Services.
Human Services. So then we'll have joint hearings for those. Wow, that's a wide gamut of the issues you have to deal with. Wow.
And it's a lot of reading and a lot of networking and coordination to deal with a wide variety of issues. Because and so that's one of the things I appreciate about our committee, is that every member is willing to learn and listen, and then that's very important when dealing with a whole host of issues. Well,
I know, like in my community, we don't have a lot of health centers except for the Waianae Comprehensive Health Center, which I'm sure you're probably familiar with, and then finding out more of these rural health centers. There's even more issues with those versus like a hospital, you know, and even last year we dealt with some of that, and we were just up on the Big Island looking at the newer one they're putting in, and in Molokai they're putting one over there, and seeing where, you know, some of the services are shifting to community health centers. So in my community, there's a lot of issues health-wise, like diabetes, you know, obesity, and how we can start, you know, helping to move those challenges, and how we're going to help people with the families. So what kind of issues have you heard regarding, you know, those type of issues and the community centers?
Well, the community centers is vital. And Waianae Coast Comprehensive is vital out to that community. You know, they have that ER, one of the very few, I think, you know, the only one I think in Hawaii, and very few in the nation that actually have a running ER to help the people out on the coast. And you know, these health centers are vital for our community health. You know, they see people right away. People who have access problems, transportation problems, language barriers, you know, have this avenue to get appropriate health care right away. And so, you know, without them, our whole health community would be totally different. On your side of the island, you mentioned diabetes. That's an ongoing problem. And not only diabetes, but people have mentioned obesity, other issues affecting health is substance abuse, you know, which affects statewide. However, you know, for us, one of the things that I'm concerned about as chair is that you have that single road in, except when the military opens the pass, but primarily you have that single road in and out. And so if there is a healthcare situation out there, it makes it more difficult to make sure that to get services and quickly out there if need be. And so, you know, we've always been looking at that, how to get resources out to your community. How do we expand emergency medical services, the ambulance out there? You know, one of the things I wanted to make sure is to ensure that your ER out there is funded. And then where do they go from there, you know, to the next stage after Waianae Coast stabilizes them? And because it's a system, and working. You know, I did services out there on the coast, and there's really great people. You know, Nanakuli, Waianae, some of the best, biggest hearted family ohanas out there, you know, any place you go. And so, you know, those are important, and we want to make sure that the residents out there have the same high quality care and access to that care. And so, you know, programs to look at expanding that, making sure that people who go to school out there, live out there, maybe can get education now, maybe at West Oahu, to become medically trained, you know, to enter the medical field as future doctors. And so, you know, there's a lot of things that we're looking at to try to spur that on, to address some of the health concerns in the communities.
I know in the past, you know, I've been out there for quite a while, and that's always the challenge. We have this emergency facility that they're always like, well, we're going to run out of funds, we'll have to close it during the evening hours or the daytime hours, and how, you know, the legislation has come forward to help keep that open. And then we had the challenge, which is still current. As you said, one way in, one way out. And if you have an emergency situation, you get stabilized, we can put you in an ambulance, but still that might not be enough time to get you to a trauma center. And we used to have the heliport out there with helicoptering emergency. And we don't have that with you know, the escalation in the Middle East, and the Army providing that service, and you know how vital those things are to our community. And I know you were working on, you know, some discussion of possibly increasing some ambulance service out there, because you know we're limited to X amount of ambulances on the service, and you know, God forbid we have a major accident and you need 4 or 5 of them. You know, I know you were working on some stuff and talking about that for next session possibly.
And again, that's a working relationship. We're working actively with our current administration. We're working with Director Dr. Ireland in Emergency Medical Services on how do we keep that access to all of our communities at the highest level so that all of our people can get services. And so, you know, we're always looking at that and always trying to find ways to make sure that the people of Hawaii have the best quality care.
And then how, with these health centers out in the rural areas, how can we build upon them to provide more services out in the rural areas than having people to transfer or travel to like a Central Oahu hospital or a Honolulu hospital, and how can we get more normal care out there, you know, maybe psychiatric care, maybe, you know, therapy care, maybe just regular doctor visits, you know, more. I mean, we're on Molokai, it was so important to see an x-ray machine, and you never think about that until like, wow, you know.
When you didn't have one, now you have one.
You have one, and they don't have to fly to Oahu to, you know, and when you take those concepts to even on Oahu, you know, how can that individual that might not have vehicle transport to a facility that can provide them that test or that service, and, you know, and how important it is to have like dialysis within those rural areas. You know, that's what I see your committee about, and how do you vent all those issues, and maybe even work with the health department, maybe even work with human services on how that works out. And you have a relationship, I guess, with Director Fuddy.
And human services, Pat.
Yeah, so when you're saying that sometimes things might not need to come through committee, you can actually maybe go to the department and say, how can we work out these challenges without creating a legislation, or maybe us telling them what to do with their departments, right? I mean, that's kind of what you're saying, right? It's building those relationships and saying how we all can work together for this.
And basically that's what it is, you know. The goal is, it's hard to go back to, you know, our community and say this is not happening or happening because we weren't willing to work together. And so people expect us to work together. And I think, you know, with this administration and new directors and the deputies, you know, I'm excited to see some of the levels of collaboration. You know, I'm looking forward to some of the ideas that are going to be brought down and expanded on. We may not always agree. You know, some issues we might not agree. Could range from the type of services or the level or taxation or how to pay for it. But, you know, all these are part of the, you know, the legislative process where people can express, you know, their opinions, and then we have to work through that.
And how do we're kind of like the intermediary people. You know, you kind of put everybody at the table and see how we can work these situations out and move things forward. Sounds like you really enjoy the health committee. It sounds like a challenge,
well,
really. I mean, it is.
I enjoy being able to network and work with the variety. I enjoy health committee because I've been doing health as a social worker for many years. You know, and the issue is for me, I like policy. I like to be able to come up with good, balanced policy with the intent of helping everybody. And so, you know, I like to see that. I like to see new legislators like yourself come in. I would like to see those from your communities who've grown up in the Waianae Coast become our future doctors, our nurses, our CEOs, because, you know, that background, that groundedness into the Aina and the Ahupua'a kind of framework really, you know, transcends all that and can, you know, should be looked upon as an asset, you know, because so far now we need more local people becoming involved in our local healthcare system.
Oh yeah, we do. I think that would be a new movement for us to get more, you know, local people as doctors, as the practitioners, and to infuse more of that Western, I mean, we have the Western template, but to infuse more of our native Hawaiian. And I think that's what our comprehensive tries to do out there. And it's kind of worked out pretty well from what I've seen. A lot of people come and look at that setup and say, hey, these things are really working. And, you know, again, it's about the constituent or the client in that health environment and how it's working with them.
And, you know, we have a lot of people who come from the mainland or across all across the world who have Hawaii at heart. And so, you know, they bring a wealth of knowledge. And so that's great. And so, but the more they stay here, the more we want to, you know, promote them and get them going, because the future of healthcare is going to be even more expensive. And so when we have people who are committed to the community, it makes it even better, because then it's rooted.
Yeah, that's true. I didn't realize you had to deal with so many issues. I mean, that's a huge committee. That's a lot.
It's a very challenging issue, and many times some of the issues that you have seen over this past year is it can be very emotionally charging.
Yes, it can
Some
be.
people feel so strong that it's one way, and then other people feel just as strongly it's the other way. And so at times, as you can see, some of these issues can pull in very emotional reactions. People feel, religious commitments. There's a lot of these issues have so many different type of overtones, from cultural to, historical issues that it can be quite, touchy. And one of the difficult things as chair with this committee is making sure that everybody is not only heard but respected, making sure that it comes out balanced. And so sometimes issues are not ready to be heard in our committee, and others are. And so it's always a challenge. We're always getting pulled in different directions. And new things pop up every day.
Yeah, really, every day. Yeah. Well, I can see we're kind of running down to the wire right there. I'd really like to thank you.
No problem.
And I thank you for allowing me to be part of your committee. I really enjoyed it. I really have.
My pleasure.
Yeah, I'm learning a lot more about health issues, and thank you for being on my show today. And I'd like to thank you for being one of my mentors in here.
Oh, thank you.
I totally
That's an honor.
appreciate it. So, again, I guess I will tell everybody out there in Olelo land, thank you. So again, thank you for joining me on Jordan's Journal with Representative Ryan Yamane. Aloha.